Okay, this is Bill doing the last lecture burst, 40 through 42. Um, Pediatrics and child musculoskeletal conditions. This structure, this gives you some terminology to learn, what kind of tractions, extensions, whatever. Um, Differences between a child and an adult: bones are not completely ossified. The epiphyseus is present. The periosteum is thicker. Damage to the epiphyseum can alter bone growth and development. Skeletal growth is more rapid and can cause overgrowth in fractures in children under the age of 10. The epiphyseus is part of the bone that allows it to grow. This is located at the end of the long bones. The epiphyseal plate normally closes around the age of 17. The process generally happens between the ages of 13 and 15 in females and between ages of 15 and 17 in males. Um, Assessment of the musculoskeletal system in a growing child is to identify deviations from the norm. Must have an understanding of what is normal for that age group and child. Assessment include observation, palpation, range of motion, and gait in children that can walk. The nurse must have a general understanding of what is normal for a growing child. Gait: the toddler has a wide gait that is unsteady. By 18 months, the wide gait has narrowed and is more stable. By 4 years of age, the child can hop on one foot. By 6 years of age, the gait resembles an adult. So they're getting more and more like us. Muscle tone and neurological exam. Symmetry of movement and strength of the body and extremities. Have children push away with their hands and pull towards you with them. You can test the strength of the extremities, the reflexes, the sensor. The neurological exam is an easy and quick way to look at a child's growth and development and make sure that they are meeting developmental goals or standards. Sensation: check for numbness or tingling. Sensations in the extremities. Loss of sensation can indicate nerve damage. Skin temperature: monitor the temperature of the skin. It should be warm and not cool to the touch. Skin color: observe the color of the affected extremity. Compare and contrast the skin above and below. Capillary refill should return to blood flow within 3 seconds. Pulses should be palpable and strong. Pulses should also be equal to the pulses on the unaffected extremity. Movement: the child should be able to move the joints distally to the injury, fingers and toes. Diagnostic tests for the musculoskeletal system: radiographic studies, bone scans, computer tomography, magnetic resonance imaging, MRI, ultrasounds. All of these tests have their place in the exam of a child. Some of them are harder to get down due to the fear factor of the child experiences. Other tests include CBC, SR, HLA, which is a human leukocyte antigen. How would you explain these tests to a child to reduce their anxiety and fear? Stop and think about that for a second. You always have to tell the child the truth. Do not lie to them. They will find out and they will never trust you again. Soft tissue contusion is the tearing of the subcutaneous tissue, resulting in a hemorrhage, a sprain, when the ligament is torn or stretched away from the bone. That's a sprain, and a strain is a microscopic tear of the muscle or tendon. Fractures is a break in the bone and is mainly caused by accident. Characteristics by pain, tenderness, and swelling. Colorization is usually a little bit off. Soft tissue injury treatment requires first 3 days of rice. That method is rest, ice, compression, and elevation. When applying ice, make sure that to protect the skin from any of the cold or freezing or burning of the skin. Compression, make sure that it is loose enough that it is not cutting off the blood supply. These are the types of fractures. You need to know these. Spiral fractures is a break that spirals around the bone and is often associated with child abuse and are caused by a wrenching force. Most fractures are diagnosed by the cause of pain and lack of use of that limb. Complications of fractures. You have the compartmental syndrome, which is a compression of nerve, blood vessels, and muscle inside the confined space. Results in neuromuscular ischemia. Untreated can lead to deformity and extremity paralysis and infection. Volkmann's contracture is a permanent contracture of the forearm and hand, causes from too tight of dressings and cast hemorrhage, burns, surgery, or massive IV infiltration. Remember the 5 P's. Pain, paresthesia, pulselessness, paralysis, and pale are the 5 P's. Traction. Now we have different types of traction. You have Bryant's traction, used on children under the age of 2 and weigh less than 20 to 30 pounds. Buck's traction is a type of skin traction used in femur fractures and hip and knee contractures. Russell's traction is similar to Buck's traction, except for the way the traction is applied. These are pictures of the different types of tractions. I've seen just about all of these in my years of doing nursing. Disorders of the musculoskeletal system. Osteomyelitis is an infection of the bone, usually under the age of 1 or between the ages of 5 and 14. It's caused by the Staphylococcus aureus, 75 to 80% of the time. Leg calf Perth's disease is a disease that is part of a group of disorders that have a decrease in blood supply to the epiphyseal or end of the bone. Aseptic necrosis forms of the femoral head can be a unilateral or bilateral. Client experiences pain and swelling at the site. Leg calf is a self-limiting disease that heals on its own. Sometimes you will have to have a child partly or totally immobilized for treatment if they need casting or bracing as a treatment. Usually affects children between 2 and 12 years of age, with most of them around the age of 4 to 8. More common in male children than in females. So the osteosarcoma is a primary malignant tumor of the bone. It usually shows up around the age of 10 or 15. The sarcoma grows rapidly due to the good blood supply. Removal of the tumor usually involves the amputation of the bone and extremity. Long-term prognosis is good if early detection. First metastasis is to the lungs from the bone. Metastasis from to the lungs and other long bones can happen. Amputation is usually not necessary with the Ewing sarcoma. Okay. Duchenne's muscular dystrophy is part of a group of disorders that have progressive muscular degeneration. Duchenne's MD is the most common. Onset is age 2 to 6 and usually seen in boys more than girls. This also progresses to experience intellectual impairment is common. It is diagnosed by marked increase in blood creatinine phosphate levels, CPK. Muscle biopsies reveal a degeneration of the muscle and replacement with fibers by fat and connective tissue. EKG abnormalities are also common. This disease progressively worsens and the client becomes wheelchair bound. Death usually occurs from a cardiac event or respiratory failure. With this disease, the nursing care is primarily supportive and the child and family may experience severe depression. Scoliosis, a very common thing for women this time. The most common of the three skeletal abnormalities, an S-shaped curvature of the spine. A lot of girls are checked for this, usually about the age of 12 or 13. They're checked in school, usually accompanied by a rotation of the spine and hips and shoulders. Looks uneven. Treatment for scoliosis is using of a Milwaukee brace, and the that exerts pressure on the chin, pelvis. It is to be worn 23 out of 24 hours a day, and usually used for curvatures between 20 and 40 degrees. For more severe curvatures, they use Harrington rods that are placed surgically, and they are also used with a halo traction. CP, or cerebral palsy. The majority of children with CP are born with it, although it may not be detected for months or even years. Cerebral palsy has no cure, but treatment can improve child's capabilities. Brachial plexus injury. This occurs when the nerves are stretched, compromised, or in the most serious case, torn. This can happen when the shoulders are pressed down and the head is pushed up. Babies sometimes sustain brachial plexus injury during the birth process. Spina bifida is also known as myelodysplasia and is used to explain a group of congenital defects in which the fetal spinal cord fails to close completely. It's not the cord, it's more the spine around it that is not closing. The cause is not known, but it is believed that it is genetic, nutritional, and environmental factors that may play a role. Spina bifida occulta mostly affected the lumbosacral area and is not visible. My brother has spina bifida occulta and never bothered him much. He was able to go in and do 4 years in the Navy and all that other stuff. So rides bicycles and all that, motorcycles and all that kind of stuff. Spina bifida cystica. A protrusion of the sac is visible. Meningoceal. The sac contains spinal fluid and meninges. Myelomeningocele. The sac contains spinal fluid, meninges, and nerves. Risk factors: medication taken during pregnancy, malnutrition, insufficient folic acid, exposure to radiation or chemicals during the pregnancy are the most frequent cause. Family violence and abuse. Violence is something that has come to cross all socioeconomic barriers. Types of violence: there's spousal abuse, child abuse, neglect, and maltreatment. Child abuse may show up as emotional abuse, emotional neglect, sexual abuse, physical neglect. Sometimes it can come up with damage to the musculoskeletal system, and that's why we have it listed here. Okay. Safety alert for bruising. Bruising heals at a specific rate according to color. 1 to 2 days is swollen and tender. 2 to 5 days red or purple. 5 to 7 days green. 7 to 10 days yellow. 10 to 14 days brown. And then 14 to 28 days it clears. It is important to ask yourself, does the bruise match the caregiver's explanation of events? Hopefully it does. Okay, now child with skin conditions. Now the skin conditions can be quite exorbitant. These are some of the terminologies that you need to know for this class. You might come across those, okay? Skin disorders, seborrheic dermatitis, cradle cap, which is seen in newborns, infants, and at puberty. A lot of people think it's dandruff, and treatment is shampooing hair on consistent basis. Malaria rubra is prickly heat or rash caused by excessive body heat and moisture. Sweat is retained, and it appears suddenly as tiny pinhead-sized reddened papulas. May be itchy, often appear in diaper areas and skin folds. Remove extra clothing, bathe, skin care, frequent diaper changes are needed for this one. Diaper dermatitis, skin barrier becomes irritated by prolonged contact with urine, feces, or retained laundry soap and friction. Regular checking of diaper is necessary to prevent rash. If you are using service diaper are sterilized, it washes at home. Make sure that you get a second rinse to remove any soap residue. Acne vulgaris is what we normally know as teenage acne. Inflammation of the sebaceous gland and hair follicles. Sebaceous follicles enlarge at puberty, secrete increased amounts of sebum, fatty substance. Comedo is a plug of keratin, sebum, and bacteria. Open blackhead, closed, or whiteheads responsible for inflammation process. Routine skin cleaning. Greasy hair and cosmetic preparations should be avoided. Excessive cleansing can irritate the skin. Multiple topical and oral treatment is available. Important to stress to adolescents to follow medication treatments as prescribed. Infantile eczema. Eczema is atopic dermatitis is a inflammation of the genetically hypersensitive skin. Spongiosis, or breakdown of the dermal cells and formation of intradermal vesicles. Rarely seen in breastfed infants until they begin to eat additional foods. Worse in the winter. Lesions easily infected with bacteria or viral agents. Infants and children with eczema should not be exposed to adults with cold sores because they can develop a systemic reaction with high fever and multiple vesicles on the eczematosis skin. Parent teaching about medication to treat the eczema is ointments should be completely washed off between applications. Cortisone creams should be avoided. How to apply the topical medication is there for you to read. Ointment is applied after a warm bath. This helps with the skin pores opening up and being able to be more effective that way. Teach how much ointment is to be applied. To the use of elbow restraints can prevent an infant from scratching while allowing freedom of movement. Do not use topical steroids when a viral infection is present. Staphylococcal infections. Primary infection may develop in newborns, and the umbilicus or circumcision wound may occur while in the hospital or after discharge. Treatment includes treatment with penicillin or erythromycin for 10 days, daily washing of crusty skin, and use of Bacuben ointment may help. Okay, impetigo can be caused by Staphylococcus group A beta hemolytic strep. Bularius form seen in infants, usually streptococcal. Non-bularius form is seen in children and young adults. Newborns susceptible because resistance to the skin bacteria is low. Very contagious. Treatment is either oral or parenteral antibiotics. Okay. Other skin disorders. Fungal infections invade stratum corneum, hair, and nails. Fungi are larger than bacteria. Taena capitis is alopecia. Then there's Taena corporalis, which is the oval, scaly, inflamed rings with clear centers. Taena pedis is lesions in between the toes, otherwise known as athlete's foot. Taena curetis is jock itch. It's an inflammation around the pubic area. Pedilocus, there's 3 types. There's capitis, which is head lice. Corpus is body lice, and pubis is pubic lice, also known as crabs. It's a parasite caused by female mites, burrow under the skin and lay eggs, especially between fingers. Burrows contain eggs and feces. Itching is intense, especially at night. Thrives in moist body areas. Spread to close personal contact. Treatment is the application of permethrin. All family members, as well as the home and car, required for the treatment to get rid of them. Okay, burns, leading cause of accidental death between the ages of 1 and 4 years of age, sometimes result in the result of child abuse. Children response to burns, skin is thinner, leads to more serious depth of burns with lower temperatures and shorter exposure times. The types of burns: you have thermal, due to fire or scalding vapors or liquid. Chemical, due to corrosive powders or liquids. Electrical, due to electrical current passing through the body. And then radiation, due to X-rays or radioactive substances. Large body surface areas of a child results in a greater fluid, electrolyte, and heat loss. Immature response systems in young children can cause shock and heart failure. Increased BMR results in increased protein and caloric needs. Smaller muscles and fat content in the body results in protein and caloric deficiencies when oral intake is limited. Immature immune system predisposes child to developing infection that complicate burn treatment. Prolonged immobilization and treatment required for burns adversely affects the growth and development of the child. Superficial, first degree. All are considered minor unless under 18 months and or over 65. Moderate, second degree. Partial thickness burn involves 15 to 30% of the body surface. Full thickness burns involving less than 10% of the body surface. Severe is over 30%. Major burns is third degree. Partial thickness involving 30% or more of the body surface. Full thickness burn involving 10% or more of the body surface area. Both types are considered open wounds that have the added danger of infection. Electrical burns, child should be assessed for entry and exit location or lesions. Indicates path of electricity through the body. Muscle damage can occur. Deep muscle damage can cause renal and heart damage that will not be seen till much later. Child should be monitored on an EKG monitor and vital signs recorded frequently. Cardiac enzymes should be run serially. Emergency burn treatment. Stop the burning process. Evaluate the injury. Cover the burn. Transport to the hospital. Establish an airway. Cyanosis, singed hair, nasal hair, charred lips, or stridor indicates that the flame may have been inhaled. An endotracheal tube may be inserted to protect the airway. That's something that you might have to do. Establish an intravenous line, obtain blood and other bodily fluids for laboratory testing. Nasogastric tube may be inserted to empty stomach and prevent complications. The rule of 9, Ludd-Bordeaux chart, and you can see where that's at and know those two. The child with communicable disease. Third and last one. Thank goodness, right? Anyway, this is terminology that you have to be aware of. That's going to help you get through the course. Communicable disease prevention and control are the key factors in managing infectious disease. As you know, right now we are going through a communicable disease alert because of COVID-19. HIV, hepatitis, TB, and STIs are infections that occur worldwide. The incidence of common childhood communicable diseases has decreased with the use of appropriate immunizations. Review of terminology. Communicable disease can be transmitted from one person to another. Incubation period, time between exposure to the pathogen and onset of the clinical symptoms. Prodromal period is the time between earliest symptoms and appearance of the typical rash or fever. Vector, an insect or animal that carries or spreads the disease. Pandemic, which we're experiencing currently with COVID-19, a worldwide occurrence of the communicable disease. Epidemic is a sudden increase in the disease in local areas. And that, so as that goes in there, it changes how we look at things. Virulence of infection. Host resistance to the disease is influenced by age, sex, genetic makeup, nutritional status, physical and emotional health, intact or skin or mucous membranes, and functioning immune system. That is why older people are more susceptible to the COVID-19, is because their immune system is not as virulent as it once was. So, Types of immunity. There's natural resistance to inborn, acquired, not born with it as a result of having disease and receiving vaccinations or immune serum. Active immunity, when a person produces his or her own immunity. Passive immunity provides the antibodies to the person, does not last as long. Okay? Hand hygiene, that is something that is very important with COVID-19, is that you want to make sure that you wash your hands for 20 seconds and wash in between patients and after removal of gloves. Family education to prevent spread of infection should include hand hygiene, necessity for immunization, proper food storage, use of pasteurized milk, proper defrosting and cooking of meat, avoid using community towels, control of insects, and avoid of use of a sandbox. Because what do sandboxes in the yard become? They become outdoor kitty litter. Rashes of the skin. There is erythema, which is diffuse and reddened areas. Maculas are circular reddened areas. Papula is circular reddened areas that are elevated. Vesicles, circular reddened areas that is elevated and contains fluid. Pustules is circular reddened areas that is elevated and contains pus. And scab is dried pustule that is covered with a crust. And a pathogenomic term used to describe a lesion or symptoms that is characteristics of a specific illness. Koplik spots are seen in measles. Okay, that's what an example would be. Vaccines. This is different names and discussions of vaccinations and types and what you need to know for immunizations and talking with specific people with immunizations. Counterindications for immunizations is immunocompromised state, pregnancy, bacteremia or meningitis. Immunocompromised caregiver in the home requires individual evaluation by the healthcare provider. Corticosteroid therapy requires individual evaluation. History of high fevers and other reactions after previous immunizations. Nursing tips and interrupted vaccination series can usually continue without restarting the entire series. Apply lotions to open wounds sparingly to avoid absorption of the lead that can lead to drug toxicity and infections. Future of immunotherapy, refining and combining vaccinations continues. Transcutaneous immunizations through intact skin. Recombinant DNA technology is developing vaccines to use for rheumatic fever and malaria. Development of RNA and DNA viruses to be used as vectors, carriers of antigens. Development of gene gun to blast vaccine through intact skin, and other things. Sexually transmitted diseases, infection in children. Infection spread through sexual activity can be spread from pregnant mother to fetus. Can be spread through sexual abuse of a child. Can be spread by use of contaminated needles or exposure to blood. Nurse required to report STIs to the local public health department. Contacts of infectious person also need to be tested for that. Okay. HIV and AIDS in children. Children usually contact HIV by contact with infected mother or at birth, sexually contacted with infected person, and contact with infected needles or blood. HIV-1 attacks lymphocytes and causes imbalance in the helper T cells, CD4+, that support immune system and suppresses the T cells that shut it down. The CD4 cell count is a measure of the damage of the immune system caused by the HIV and guides treatment options. ELISA test and Western blot test to diagnose HIV are not reliable in children under 15 months of age. Manifestations are failure to thrive, lymphadeneuropathy, neopathy, chronic sinusitis, failure to respond to treatment of infectious thrush, pneumocystis carovoki or carni, pneumonia, herpes infections, UTIs. Treatment is supportive, no cure for HIV or AIDS. Medications, nucleoside reverse transcriptase inhibitors suppress the synthesis of viral DNA. And it goes on and on. And new things are coming out every day. Emotional and behavioral conditions. The nurse is the person that has the most interaction with the family and child. Assess the child-parent interaction is critical for healthy development. The stresses that are being placed on children and families are greater than ever. Bullying, war, economic problems, homelessness, sexual behavior, peer pressure, single-parent households. These are all things that can cause stress on the family. Childhood autism may be due to autosomal recessive inheritance. Signs and symptoms: failure to make eye contact, poor attention span, poor response to name, does not engage in pretend play, requires highly structured environment, use one request at a time. Treatment: drug therapy has been used in some cases to decrease a hyperactive child, and with some success. Suicide, third leading cause of death in adolescents after accidents and homicides. Completed suicides more common in boys. Attempted suicides are more common in girls. Risk of successful suicide increases when they have a plan of action, a means to carry out the plan, an absence of obvious resources turned to help, and low self-esteem. Suicidal ideation, thoughts of suicide, suicide gestures, an attempt at suicide action that does not result in injury. Suicidal attempts, an action that is seriously intended to cause death, can be impulsive act or chronic behavior. Nurse's role is education, prevention, identification of those children at risk, and prompt referral of follow-up care. When an adolescent feels hopeless and talks about feeling useless and worthless, do not contradict what he or she said. Instead, listen, indicate your understanding, and encourage the expression of feelings. Okay? Attention deficit hyperactivity disorder, ADHD. Screening tools can enable early intervention, may have problems with dyslexia, dysgraphia, receptive to expressive language. Information processing, memory, motor coordination, orientation, confusing left and right. Those are some of the things it is. Obsessive compulsive behavior. There's a YouTube video right there that you can go to and see what it is. It's where something has to be done a certain way every time, no matter what. Any of you that have watched the Sheldon show where he knocks 3 times and says your name and knocks 3 more times and says your name and knocks 3 times, that's a obsessive compulsive treatment and medication. A type of psychotherapy called cognitive behavior therapy is especially useful for treating OCD. Antidepressants are used to treat depression, but they are also particularly helpful for OCD. Okay, we're almost done. Anorexia nervosa is a form of self-starvation seen mostly in adolescent girls. Criteria according to the DSM-4 is failure to maintain a minimum normal body weight and age and height, an intense fear of gaining weight, excessive influence in body weight and self-evaluation. Amenorrhea may be genetic. Patient characteristics average or to superior intelligence, overachiever, who expects to be perfect in all areas, threatened by their emerging sexuality, obedient, non-assertive, and shy, low self-esteem. On physical examinations, may find dry skin, amenorrhea, lanugo, hair over the back and extremities, cold intolerance, low blood pressure, abdominal pain, constipation. Adolescents experience feeling of helplessness, lack of control, low self-esteem, and depression. Socialization with peers diminish. Mealtimes are a battleground. Body image becomes increasingly disturbed. A lack of self-identity. Treatment may require hospitalization, corrective electrolyte imbalance, establish minimum, restoration of nutrients, stabilize the weight, individual and family therapy, and medication. Okay. Bulimia, which is also a type of eating disorder, but where the person will eat and then make themselves throw up. Mother-daughter relations usually distant and strained. Binge purge cycle thought to be a coping mechanism for dealing with guilt, depression, and low self-esteem. Impulsive behaviors also characteristic. Persistent vomiting causes erosion of the tooth enamel. Nursing role is education, prevention, identifying, and referring. Okay? All right. Done for that day, right? Hopefully. Be safe out there. I'll see you when I see you. Okay? Bye.